Join us on a journey of discovery across 200 sessions and over 400 speakers from across the world. Sharing their vision, mission, innovations, and achievements. At Catalyzing Change Week, the largest convening of social innovators online. Connect, share, and learn from the best in the ecosystem. Brought to you by Catalyst Now.
Hi everyone, I'm May from Rise Impact. I'm gonna be the moderator of the session today. First of all, we will start from the housekeeping that we are together in this session. Please keep your video on if it's possible and show your name or your company if you are comfortable with that, and unmute when you speak. And if you have any technical question, please raise your hand. And the other one is if you have any question or comments, please feel free to write in the chat box. So we have our team to gather all the comments and enjoy the session. So the session that happening now is a part of the Catalyzing Week. And our session is we're gonna talk about beyond healthcare social support system for independent aging. And the session is co-hosted by Rise Impact. Let me start from briefly introduce our today panelists. We have 4 people today like on the stage now. The first one is Tomoe Ueyama. Tomoe founded Project Mint in 2020 by help mid to late career professionals in Japan rediscover their ikigai and transition to more fulfilling work. And the second one is Kun Jen Wit, or we can call him Jane. Visot Songkram from Buddy Home Care. He is the co-founder of Buddy Home Care from Thailand. The third one is Kun Chakrit Promyot from Young Happy, the co-founder of Thailand, and me, the last one, who's gonna be the session moderator. I'm from Rise Impact. I'm the co-founder of the organization. As I mentioned about Tomoe already, so I'm gonna pass to Young Happy. Gap is the co-founder of Young Happy that initiate to empower adults aged over 50 through lifelong learning and social participation, and trying to help them stay active, independent, and connected by using technology. And last but not least, Kun Jen is the co-founder of the Buddy Home Care, an initiative that delivers affordable, high-quality in-home care for frail older adults in Thailand, in rural area and semi-urban area by training local caregivers to provide the service. So I will start from myself to share the overview of the aging situation in global and regional and also in Thailand to all of everyone. And then we'll move to ask the panelists to introduce themselves one by one. So I'm gonna start first. Let me share the slide just a little bit. Okay. Okay, now you guys see the slide that I'm sharing? No. The screen is not working. Okay. It is working now?
Yeah, the slides can be. Yeah.
Thank you. So in this session, I think to set the stage for our discussion, I would like to begin by sharing a brief overview, by sharing the aging situation globally, regionally, and here in Thailand to help us understand more about why this topic is so important. Aging is a whole of society transition that requires social system, housing, community, and transportation, work, and tech beyond the medical care. So why this matter? Longer lives, fewer children, smaller families, these change who provides the care and where older people lives and how they can remain independent. Aging is a global megatrend that reshaping the economies, families, and city. Aging can be understood through biological changes or by recognizing the emergence of various complex health conditions, commonly referred to as geriatric syndromes. So over the decades, as shown in the shade of blue and green, each layer of the pyramid widening, meaning that people of all age were living longer and surviving more. But the key change is that the population growth will no longer come from more children being born, but from people living longer, a few up at the upper part of the pyramid. So this remarks a turning point in human history that we are moving from an era of population expansion through births to one shaped by longevity and aging. And from the inside, from WHO, all nations are confronted with significant challenges to ensure that health and social systems are adequately prepared to leverage the demographic change. The pace of population aging is much faster than in the past. By 2030, 1 in 6 people or 1.14 billion individuals worldwide will be aged 60 and older, with projections indicating that the number will rise to 2.13 billion by 2050. This means that approximately 1 in 5 people globally will age over 60 and above. By 2050, 80% of older individuals will reside in low and middle income countries. Additionally, the number of individuals aged 80 and above is expected to grow significantly, representing the largest relative increase among older age groups, and women make up a larger share of the oldest age groups. So in Southeast Asia, the number of older adults is expected to rise from 77.4 million in 2020 to 173.3 million, or 22% by 2050, marking one of the fastest demographic transitions globally. Many ASEAN countries face a compress of demographic transition, which means that only 20 or 30 years that the transition happened, which is a faster rate than in the developed countries. And Thailand, Singapore, and Vietnam are among the fastest to age. Policy is urgency now. So in Thailand is already an older society with rapidly rising 60 to 65 cohorts, and the sustain low fertility, rising longevity, and urban migration is the cause of the aging population in Thailand, and it is also the same situation as in Japan, which we invite Tomoe, who already has an experience of the age society, to talk with us today. And the effects of demographic change, it's make the economic happen in the way that it's shrinking labor force, rising old age dependency ratio. So there's a pressure on public budgets and the service demand. So more long-term care, accessible housing, transportation, social protection, and dementia service are needed. And household, smaller family networks, higher likelihood of older adults living alone or with one caregiver is more and more. So when we talk about social support system, it means much more than the clinical system. It means that we integrated non-clinical system that enable older adults to live safely, independently, and participate socially. There are some common or core components of the social support system that we are talking about, such as age-friendly housing and public space, community-based care networks, social protection and pensions, accessible transport, digital inclusion, and caregiver support. Meanwhile, there are some key challenges that not only in Thailand but in the region and in the global that the first one that the service are fragmented across ministry and providers. The second one is the shortage of trained long-term care workforce and caregivers and other providers that provide service for the adults. And the third one is inadequate home and community infrastructure like housing, accessible transportation. The third one is the the fourth one is the digital exclusion for some older adults and rural populations. And last but not least, the financial insecurity. There are gaps in pension coverage and old age poverty risk, especially in our country that is still the developing country. However, there are some opportunities and innovations that emerging to help this situation. The first one is age-friendly cities and housing retrofit programs, or sometimes we talk about home modification for aging in place to help people live in their own place or the place that they want to live. There are some community-led care volunteer networks, trained community caregivers. Sometimes they are tech-enabled, but people-centered solution that happen, not only tech that help people, but the tech is designed to support people who are the user of that technology, like telecare, simple assistive tech, digital literacy programs. Besides, there are intergeneration programs to maintain social participation and reduce isolation. And sometimes we talk about public-private partnerships for silver economy. We talk about the policy for independent aging, which are responsible by the government. So in summary, aging is not just a health challenge, it's a social transformation that affects how we live, work, and care for one another. We have seen how global and regional trends are shaping the future and how Thailand is already experiencing these changes firsthand. And also in Japan, that's already experienced those of challenges. So how can we help people age independently, living longer, healthier, and happier lives while keeping the healthcare system sustainable? To make that happen, we need to think beyond the hospital and clinic and start building social support, inclusion, and everyday life. So from this, I would like to set the stage by starting from all of the panelists. Please introduce or share your story, what you are working on, what are the impact story of the solution or the idea or the project that you are working with. So people will get to know each of you one by one. We will start from Tomoe, please. Okay, let me
Thank you.
stop sharing.
Yep, thank you. Yep, so thank you so much for the informative overview of the aging situation in Thailand and Asia Pacific overall. So let me introduce myself. So good afternoon, everyone. My name is Tomoe, and I'm the founder of Project Mint. And we are the learning community in Japan that helps people rediscover their purpose and redesign their lives, especially during midlife and after retirement. And I'm deeply passionate about how we can build societies where people can keep growing and contributing, even in later life, with curiosity and joy. So my motivation came from seeing how many talented professionals in Japan lose their sense of identity after retirement. Japan is already super aged society with nearly 30% of our population over 65 years old. And many people live long lives, but they struggle to find meaning after leaving full-time work. I met so many people who said, I don't know who I am without my job. And that made me realize longevity without purpose or connection is not real well-being. So I wanted to create a space where people could unlearn old definition of success and reimagine their next chapter, not alone, but together. This effort led to the establishment of Project Mint in Japan in 2020. Project Mint stands for Meaning, Ikigai, Network, and Transform. And we are a learning community dedicated to reimagining leadership through the lens of individual purpose and Ikigai. So Ikigai is a Japanese word that means reason of living or purpose of life and so on. Yeah, it's very difficult to translate in other language, but I think Ikigai can be a really important role, especially after retirement. Yeah. So so this is some of the pictures from our community. So we are a diverse group of people. So our alumni are really diverse people in Japan. They are mostly professionals over 40 years old, and they joined Project Min because they wanted to redefine their sense of purpose and make the new direction toward later stages of lives. Yeah, so let me introduce some of our participants' transformation stories. One of our participants, Takahiro, he's a man in his 50s, and he worked in advertising company for more than 30 years. And when he retired, he felt empty. He was unsure what value he could bring anymore. So through our program, he found his purpose, which is to respect people who want to live honestly. And now he's a freelance life coach, helping retirees and career changers. He's still learning and thriving. And this is a lady called Maya. She had been a housewife for 30 years, and her purpose became find the diamond in dialogue. And now she's creating a spaces for young parents and kids in her local communities to connect, and even works at a kindergarten. And 3 years ago, our work was featured by the New York Times. So I was really happy that our work was gaining international acclaim. And in the past 5 years, around 200 professionals have joined Project Mint. And among them, 100% of them found life purpose, and 70% of our participants made major career changes. But still, looking at the reality in Japan, we often say that we have good healthcare system, but poor social health. Our systems keep people physically alive, but loneliness and isolation are rising. Almost 1 in 3 older adults say that they have no close, known family friends to rely on, and they feel lonely. And every year, more than about 70,000 seniors die alone without being discovered. It's a painful sign that social connection is our big challenge. And we also notice another gap. For example, retired men often feel lost when they can't use their professional skills in community roles, or women who worked full-time have no clear role models for what comes next. So these issues inspired us to launch our new service called Future You, a mentoring and career design program that helps people design meaningful post-retirement lives. So we are just building the pilot program now, and it actually is kicking off in this month. So it's happening right now. It basically matches mid to senior level professionals with inspiring senior role models who are already living fulfilling lives after retirement. And this is still in the pilot stage, but we are excited about what's ahead. Hopefully, it will help people to pursue meaningful careers after retirement to contribute to local communities. And Future You is a mentoring service for seniors, helping professionals find purpose, connection, and a sense of contribution after retirement. And we match participants with senior mentors and facilitate reflective workshops and create peer learning communities where people share stories and possibilities for the future. Yeah, it's not about career planning, it's about life redesign. And our mentors' average age is 65.6 years old, who already navigated fulfilling roles in societies like freelancing to help younger entrepreneurs or engage in education, like teaching schools or anything like volunteering in local communities and so on. And I think that having this kind of role models are really important for a little bit younger generations to really get the sense of what they will be doing after retirement. Yeah, so our bigger vision is this, to create a society where people of all ages can grow, inspire each other, and contribute meaningfully. And I believe that by embracing purpose and working together in the community, we can make Japan and the world more connected, creative, and compassionate. Yeah, so this is all about my introduction for now. Thank you for listening.
Thank you so much, Tomoe. So we're gonna move next to Kun Gap from Young Happy.
Hi, everyone. Thank you, Tome, for inspiring about Mint project. I think we can saw some similar challenge from like Japan and in Thailand, right? Especially for like we call young old, right? Someone who get old, but their physical and mental health still very function, but they lack opportunity to support in society. So we very happy to saw very advancing initiative that not only support just one person, right? But you do like a pool or community who want to like sharing and support each other. Because I think it's a trend that we cannot let senior, right, get into the house, home, everyone, right? But I think it's a trend that for aging in place. So that is why Young Happy came up also. Because for me, I have a chance to facing this challenge because even I'm younger than 6 years old, but as a child of in parents who have like someone who retired, my mom and my dad, right? Like 8 years ago, I facing this challenge because my dad working with company, just one company, right? It's very small. The world very small because he worked with Nissan company or Japanese company, right? And just one company until he retired, 65. After that, I thought as a child that my dad retired. The thing that good son should do is support him as you can, right? Let him stay at home and do nothing. That is the good thing for a kid to do for my dad. But the outcome is not the thing that I expect, right? He feel lonely. Just 1 year passed by. He feel lonely. He feel lost their dignity, right? He didn't know what to do next. So that's why it sparked me to find some community for them. But because of the huge and the society in Bangkok, in other area in Thailand is different. So that's why it came up with Young Happy. So next I will share my presentation a little bit so that you can see what Young Happy done and why we are here. Okay, so as a single child in my family, I think everyone used to have concern when you have to take care of your parents, right? as the same as me, right? Because when I start to take care of my dad, I need to understand the whole picture, right, of the Thailand society. Maybe this just like recap a little bit, because we have 14 million elderly people, but if you saw, we can divide them in three groups, right? And the challenge group that my dad are in is the yellow zone, right? We call middle class, right? And middle class, sometimes they lack of support from the government, because the government, they're out of their hand already, right? They have many things that they have to deal with on the red zone. So that's why on the yellow zone, this is the group that my dad are in. And it's going bigger. Maybe it's going to be the same as in Japan, right? Japan is developed country already, so a lot of middle class people that they have to take care of themselves. And the problem is, it is the same as Tomoe mentioned. They are facing about the loneliness challenge, right? It's different from rural area that they are lack of other things support. But for this group, loneliness is the big challenge for them. And we know that if when they're facing that challenge, it might make them feel get the whole bow and get bow period soon. So our mission is we try to prolong the active periods as far as we can support for them. And three main outcome that we looking for, that we want to make them fun, right? Okay, because I think happy is kind of one thing that everyone wish to have in their life, right? That one day we would love to have a happy life. So for young happy, I think fun is kind of the thing that we define of happiness. The second one is dignity. And last one is self-reliance. From that point, we start from like 2017. We built a small group as a community, and then we build an app, and we have a web app. And right now we connect around more than 50,000 members on our platform. So start from like small point, right, that I want to support my dad, and then it's turned to be the community platform to support other people. And this is like example of our demographic in our platform. Most is female. So this is the one thing that I would like to share to you also, because this is the challenge that if we look at male order and female order, the challenge is a man, right? They higher risks in suicide than the woman. So this is the thing that we would love to like address this challenge in the future. But I would like to show you that female is more like open-minded to have a new friend, because we have one metric in our community. If you be our member more than 6 months, you should have new friend around 18 people. So that is the one key that will make them that more active. And as a social enterprise, we have like product and service to support our mission, right? And this is like a product and service that we have an activity for them. We have an event, festival, and daily activity. And one of the things that we saw right now, it make the people that change their perspective is the way we work with them. So we try to look them as a person who can do a lot of things in society. We try to not look them as a vulnerable who be only get support from other people, but we try to look at them as the one who can be a change maker or to do something in society. So this is the thing that Young Happy try to support, is like empowering. So we scale like activity space to make them more fun and connect with the friend. And the second one, we try to promote their dignity, right? We try to improve their new creative job, such as like how to homestay or digital job like that. And last one, we try to beating the gap about generation gap. So we have many innovation like challenge program for let youth to create the innovation to support the older person. So this is the last one that I would like to show you, that imagine right now our member, okay, everyone, we have more than 2,000 daily active users that they go to our website and they join a class and then dancing class like this every day. So this is Young Happy that we done. And this is the one solution that would like to show you that technology can help us to solve this challenge also if we use in the right way. Thank you so much for let me share about Young Happy. ขอบคุณครับ Oh, maybe I'm sorry to show you the last slide, and maybe this is the end of my community, maybe because many people ask me why you start this one, right? And this is the reason why we start, because we believe that the outcome of our community, if someone who be our member, okay, they can turn to be a learner. If they can turn to be a learner, it means they up to date, they have more confidence in themselves. And the second one, we believe that we can turn to be a doer, someone who can be a volunteer to support society. Or even the last one, the guy that I mentioned, he live in Chiang Mai, and he used to join our class to selling something online because he used to use that his fund to open the coffee shop. But he opened in the wrong time, right? He opened during the COVID-19. So he have to shut down his shop. But he have a lot of bean in his shop. But he don't know how to deal with it. So that he joined in our online class to selling a bean. After that, he selling the bean. And right now he jumped into the digital work. He told me last year that I met him, he be admin page Facebook for one company already. He earned around 100 USD per month. And right now he start to learning Python or other things. So this is the thing that I saw that if we give the opportunity for someone who need it, it can turn them to be another person and can be inspired to the society. Thank you so much for listening our Young Happy community.
Oh, very interesting. We move from Ikigai, the purpose of life, to how fun an adult can live, and very inspiring. So the next one that we're gonna move to is Kun Jane. Could you please share us the story of Buddy Home Care and your impact story?
Yeah, thank you for let me to join this seminar, and I very lucky that I able to learn from Mint project and also a Young Happy that we collaboration work in Thailand. For Buddy Home Care, I think sometimes people want the definition or the explain about what is Buddy Home Care. So actually, it's just a mechanism that we would like to make it make our work able to can maintain and also sustain. So that's why if we talk about Buddy Home Care, it's more more really complex program. But the easiest way that we would like to share that we just only try to fill the gap of every aging issue in Thailand. So that's why rather than I use the normal presenting that I always present about Buddy Home Care, but I would like to change something because of this topic that we talk about is beyond healthcare. So that means we also need to think beyond, because of if I just only present about my project, yes, I can share the expertise or experience that what we work, but anyway, it's out of date now because of Buddy Home Care work since 2012, but I work in this issue since 2008, and my organization started from 1999. So that means something that we already done, maybe in the future is gonna be changed. So that means the context may be changed from the last or the previous. So this is the faith of happiness that I think all of us need to put it or wearing it on the older people face. And for the Buddy Home Care for today, because of the agenda, I will cover more than just only sharing about Buddy Home Care, because Buddy Home Care just only a small project, and you already have some idea from Mint that actually also enlightenment all the work in Thailand, and also Young Happy work, some that relate to our work, and also some is something that we need to fulfill. And the context of Thailand also Kun May already cover about the context, but I would like to focus on something that we think that is very small problem, but even though it's still a lack or don't have any system to support, and the social support system that I think Project Mint and Young Happy and also Buddy Home Care to do. So that will lead to the example that I think the audience and also our team able to learn and change. And the best practice, I can tell the story of the older people that work with us, and also sharing the impact of Buddy Home Care. So the Buddy Home Care, like I said, if we would like to simplify This is like a social enterprise that provide care services for the customer need care, but the target group or the beneficiary is like both sides, the older people and also the younger people. In Thailand, we have a lot of older people, and 1/3 of them living under the poverty, living with poverty. So that means it's very difficult. Yeah, it's very difficult to like living, and because of the context of their family, they also need like a lot of support, not just only the economic, the social, and also any other things. So that means the poor one is need a lot more care. And the other side, in the same time, because of the low fertilizer and also, I mean, for the shrinking of the family structure and also reducing of like the working age, but we still have like a disadvantage or underprivileged younger people. They don't have opportunity to continue to study, and then most of them like I mean living in the poverty. So they born from the like a poor family. They don't have opportunity to learn or to study, and they don't get a good job for like a proper income and also like able to subsidy to their family. So that means they don't have like an opportunity to continue to study and don't have a good job. So they get married very early, and some of them like maybe like going in the wrong way. A lot of like Hill tribe people or like a minority group in Thailand, like a young man, most of them are related to the drug trafficking or drug. So this is a very serious problem in Thailand. And also for the women, even they try to work, the income or the payment from the labor work is less than the man. Even the work is the same, the time that they contribute to the work is the same, but they get paid lower than the male, around like 20% less than the male. And most of younger women, so they can relate to the human trafficking or prostitution. So this is a serious problem in up north of Thailand and also northeastern. And even they not relate to that problem. They married very young and get the like a newborn in that condition. So that means they unable to like get off the poverty, or the poverty can be passed to generation. So this is something that we would like to break that cycle. So the body home care provide very small opportunity to them to continue to study, but not in general, because right now we would like to fill the gap that we don't have the caregiver in Thailand. So that's why we provide the full scholarship to the younger people to train to be the caregiver. We collaboration work with Faculty of Nursing of Chiang Mai University. The curriculum just like a 3 months that they learn how to provide care, and after 3-month training, they can get the certificate and they're able to like work in hospital or in the nursing home. And they're able to also choose to work with body home care because rather than we run as a project, we initiative the social enterprise to run the business. So we able to hiring them to work with us and like have like a high payment comparing to the hospital or the nursing home to provide the care service at home for the customer that need someone to looking after or taking care. In northern Thailand, in Chiang Mai, many people always like hiring the Hill tribe people to look after their parents, but they just really like pick someone that don't have the health care skill, and also like I mean let them to do everything, do the house keeping, do cooking the food, and also like look after the parent like a house worker. But they also like expect that they need to deliver the good care for their parents. So this is something that it's not that way. So that's why we try to encourage the people to understand about like the healthcare worker or the health workforce. That's more important than they think. So this is the both side of younger people and older people that intergen to work together. For the model of buddy home care is very like easy. You can see the number one, we provide the scholarship for them to train. The number that we provide is around like 50,000 Thai baht. It's around like 1,600 or 700 US dollar per person for 3 months. It's cover like the tuition fee and also accommodation and food, because when you provide the scholarship for the disadvantaged children like this or disadvantaged youth, their family also like don't have the budget or unable to provide the daily living for them. So that's why they also deny, don't want the younger people to learn or get the scholarship. But if you just only like let them to learn in general or in the university, many of them even they graduate with the high score, but it's very difficult to find a job, because comparing to the student or the university that have the good profile, and some is like from outside country, they able to like get a good job and good payment. But for the Hill tribe people or minority group, most of them even they have the good score, but they don't get a job. So that's why many of them go back home and don't have work to do. So it's also like imprint the idea that the Hill tribe people don't want the student to go to study, because even you spend a lot of money to train, and then after that they don't have a job, and then they go back to work at the labor force in their hometown. But buddy home care changed their mindset by hiring them. So the minimum that we pay to them is around like 12,000 Thai baht. 12,000 Thai baht is around like 400 or 500 US dollar per month. So this is when we matching the customer need care. So number two, you can see we deliver our care service at home for the people need care. Some is like just only people who would like to recovery from surgery or recovery from the stroke, some kind like that. And some is about like people with dementia. So that means even their physical body is strong, they still need someone to like accompany or like take care. And most of people also like after stroke, they bedridden, they need someone to help them to recover and support or assistance on the daily living along the time that recovering. So this is the service that we can earn from the business. So we use that profit and also like the resource person that we have to provide the free services to the poor older people in number three. But in the real world, because of in the past, when we run as the foundation for older person development, we provide the free service for older people. So that means in the real life, we run number three first by the program or the project. But the project run for like, 2 phases around 6 or 9 years. But the need of care is increasing and also the project is end. So we don't have money to continue to deliver the service. So that's why we try to change the way to get the money by provide the similar services, but more like professional to the customer that they're able to pay. And then we use that profit to continue our like objective to provide the good service for the poor people. But for the community-based home care, not just only like a home visit, but we also training the family caregiver and also community volunteer to support, because of the buddy home care team unable to provide all service to all people. But the key is the family member and also the volunteer in the like a neighbor, and the home safety and low cost modification, because of we know about how to do the universal design and also how to improve the how to older people to living independent. So this is something that we can topping up to the family and also the community, and the community workshop on healthy aging and also like a social participation. So this is actually the model of body home care that the totally that we done. But the income, it can be like from the revenue from the service and also under the social enterprise law of Thailand. So we able to get, I mean, tax incentive. Our business no need to pay the tax, exemption for the tax, and also the corporate or the CSR need to like donate to body home care. They can use the receipts to deduct the tax. So this is also encourage people to participate in the like a resort for continue our scheme. So in Thailand, like Kun May already mentioned, the family structure or the pyramid is a bit changed. You can see a large like a number of older people increasing, the shrinking number of like a working age, and also very low of like a newborn. But some, I mean, the statistical also show that the active aging is very big group, like 96% also still active. Just only like 4% that need care. But this is number is last year. If you look back to 2010, the active aging is 98, and the dependent is 2% only. Even in 2010, even we have just only 2% of dependent, but we still lack of like the system that able to support. But nowadays it's increasing twice, so we still like facing the same thing. So that means if we wait and we just only not do anything, so we will be facing the very serious about the long-term care service. So that in Thailand, I think many organizations or department try to learn about like the long-term care model from many countries, especially from Japan and also in Europe. So, but we also like would like to share the case of the people that work with body home care very long time ago. She worked with us before she get old, because of in the past when we try to recruit the volunteer, we recruit the pre-aging like 45 or 50, but 25 years that we work with them, they turn to be the older people, and most of them like sharing the like the key of the social support or social I mean contribute that to help them to more like active and independently. The first one is the informal care and also the family support. The family is the key to support them. So that means many projects try to train the family member how to like take care of the older people. The community health and volunteer network. So we have a lot of like a strong volunteer network. Village health volunteer in Thailand is very strong. You can prove from the COVID-19 that we have very like a good this mechanism to help to support each other along the COVID. And body home care filling the gap by the professional home care service here in the like to support them to more like independent. No need to wait for like their adult children or their family member, because some skill need to have like the professional one to provide. And housing and home modification is support that they can live more independent. And for the social participation and mental health, so we not work with the individual older people. We work with the older people association or older people club. So that's why they have like an activity. And then the active or the strong one, they still have like have the not good day. Someday they will be vulnerable in some way. And then some vulnerable people able to support them in some like a topic. So this is something that as the group they can do the peer learning. So that means if somebody have the experience on the finance, they can train other people. They don't have like the knowledge of finance, but some people have background on the health care worker or like the nurse. They can also sharing the skill set of the healthcare. So that means not none of them are just only the one who receive, but they also like change the role every time. Sometimes they can be like the giver, and sometimes they can be the receiver. The financial support and policy support, this is something that we also need to make sure that they can access to this kind of service of the government. And also the very new thing is about the digital. But anyway, we also think about low tech or non-digital also, because of just only digital is not the whole thing, but we try to blend or mixing digital and non-digital to make the people living independently. So for the body home care, we already train like 110 younger people and also support after 82 for the short-term hiring. So in total is 192 younger people that we support. So for the customer that we provide, we able to use that profit or also like for the crowdfunding that we can raise fund to support regular for the older people. Right now, we can collect like 4,500 people. And along the COVID, we able to support not just only older people, but the family member around 3,000. So this is the story of the Buddy Home Care. Yeah, the key takeaway is like aging in place is very feasible and prefer, but need to work as a partnership or join up the social support system. Not just only Buddy Home Care able to do, we also need the local authority. We also need the family member. We also need the village health volunteer to help each other. Combining the local volunteer and professional home care and smart finance to create the resilient community care. So this is very important, because Buddy Home Care not just only like provide care service, but we try to fill the gap that government unable to do. For example, the government able to provide regular home visit, like 4 times in a month. Every week they can visit 1 time. But with our mechanism, because we work with the neighborhood, they can more regular, like 3 times a week. So this is something that we can help each other to topping up the gap that the government unable to do. So that means it should be like make it more like integrate work with every organization. And Buddy Home Care can show that our pilot can encourage the neighbor and work with the like a volunteer in the community. This model are scalable with partner support. So thank you. This is the whole of the way that we would like to think beyond, but not far future. Okay, thank you.
Thank you, everyone. Like we spent quite a little bit time for introduce each one, and I just want to recap that all of the panelists. The first one, our first panelist, Tomoe, has already shared her insights about supporting the early and midlife adults and focus on how preparation and set purpose for your life can promote aging well. And our second panelist, Kun Gap, already shared why we need to support the active elderly group and how communities and systems can help them stay engaged, independent, and connected. And finally, Kun Jane brought us to the most vulnerable support. Become very critical, but how innovative solution can solve the problem just more than one social issue, but between like many SDG goals. And that's what we learned a little bit from 3 of you. So I want to open the floor for discussion to hear from our panelists' perspective and experience. So I will start there. So what does independence for elderly mean from your perspective, like physical, emotional, social, or financial? Because we already talked about independent aging, and all of you work with many groups of elderly. So what does independence for elderly mean for each of you? Please feel free to share. Okay, we can start from Tomoe first.
Okay, yeah. So for me, independence doesn't mean doing everything alone. It means being able to live with dignity and make choices that give you a sense of meaning. So in Japan, even though many older adults receive pensions and good healthcare, emotional and social independence are often missing. For example, many men who retire from large corporations suddenly lose their social identity and their title and feel isolated, and they get extremely like frail and really like quick to feel the necessity of being taken care of by others. So in Japan, a lot of people think that the staying active and staying connected with community are really crucial to maintain their both mental and physical health. And I've seen cases where joining a local community group or mentoring younger people completely changed seniors' outlook. They regained confidence and joy. So independence includes being connected and feeling that your life still matters to others.
Yeah, very powerful. I think Gap may wanna be the next one because it's really related to what he's working on.
I
So
think
could you
Tomoe answered all the question already. I think
share?
that the whole thing that she answered, and I do agree with her, and I think that is maybe I think this question we would love to ask to ourselves what is mean independent, right? I think it doesn't depend on age, right? Even for our younger generation like us, right? Dependent that doesn't mean that we have to live alone, right? But we want to like connect to the community and still dignity on ourselves. I think some people they belong they are connect to like many people, but sometimes they feel lonely. So it doesn't depend on how many friends they have, but it depends then like they value and their life goal. I think this is come back to this one, right? So independent for me is to start since right now, right? Maybe if we like one thing that I love to share to among our like member that one thing that we saw the different thing from like Thai, Thai and Western. I saw this my feeling and my data that I survey by myself. I'm not sure if you guys went to like the beach, right? You will saw the old folk, right, from Western, right? Why they always have a book on their hand, right? They have always a book on their hand. So they have a kind of hobby that they like love to reading. But if you look at like Thai, like my mom, my dad, right? I never saw him he hold the book, right? So maybe this kind of one thing that is about the hobby, right? So for us also, I think during the COVID-19, everyone facing the loneliness challenge already, right? Even for us. So that I think independent, we should start to like think about this thing since we are young, right? So that when we are get old, so we can more well prepare on that.
Both of the speakers explain about like, independent. How can I continue? But I think for the independent, it depends also like I mean because of the perspective, because like people living in for debt and body home care perspective, we're looking for 5 dimension, the dimension of economic. So that means everybody would love about to have like a financial independence, right? Financial freedom, right? So that means it's not just only for the old age. I think every age, and it cannot happen when you get old by you not prepare when you were young. So this is about the economic perspective. And for the health independent, very similar. When even you're not old, but if you like broke your leg, so that means you need to like rest and recovery along the time that you're unable to walk. So that means you need somebody to take care or looking after you. That's just only like for the accident that you can recover. But most of the people right now, when we work as in front of the computer, we don't have the good exercise, we don't have the good food to eat. So it can lead to another problem of the health. So that means if you would like to have the health independent, so that means you need to prepare when you were young, because of if you eat a lot now and then the time that you do the health checkup and the doctor asks you to control the diet. So this is something that is not dependent anymore, right? It is not independent anymore. You need to control your intake. So this is something that is in the different of the angle or the perspective. The social also, right? All of human are society, animal. So that means we not live alone. Very similar to the older people. They don't want to isolate. They don't want to live alone. But if we found or seen someone feel lonely or living alone, so this is something that not just only for them, but the society need to concern and looking and help them. So that means when we talk about social, it's not just only older people. It's about the whole society member that living with the people, living within the world, the same world that we have a lot more older people. So that means don't isolate them as the older people, should be integrate. So that's why in our organization try to do the age inclusive work across the age, living working together. In my organization have the whole generation, start from the baby boom until the Gen Alpha. So we work together. And for the dimension of environment, because of the environment also linked to our independence. Because if the older people would love to go around, but they unable to drive by themselves, unable to use the public transport, or even unable to go to the footpath because of it's not a universal design. So this is something also relate that the environment linkage to the dependent or independent. And the last one is about the technology or digital world, because it's a new thing. So that means the new generation have a ability to adopt it very fast, but the old generation may be difficult. So that means if we also isolate them from the digital literacy, so it cannot be independent, because right now many government and also many services is also linked to the technology. So that means if you talk about independent, it should be upskill or topping up the knowledge of the digital literacy for the older people. So that means I unable to conclude what is independent. We just think that in different perspective or if different dimension that relate to the term of independent.
So what I heard is that when talking about independent, most of you agree that to live with dignity is the key word, to live with your own view for your own life. But what more that I heard is that to be independent when you age, some things can be well planned or well managed. Like maybe you're try to save your salary, do some economic dimension for your, you cannot save when you age, but you can save before that time. Or talking about health, you need to prepare and stay healthy, prepare your health before you age. But some of the dimensions that Kun Jen mentioned, or even Gap mentioned about hobby, I think there are some issues that cannot be covered by individuals, how you learned, how the society understand the difference between people who age or not, or people with different types of style of people, and also the environment, especially for the infrastructure that So you want to live by your own design or to live with dignity, but if the environment doesn't support you to travel, to stay in your house, that still be the burden for being independent. So for the second question that I would like to ask you more about the concept or okay, from your observation, what are common misconceptions do the public or policy makers or society still hold about what older people actually need? Because we talk about independence and what are factors and what are the idea of being independent, but what are the misconception or misunderstanding about older people and like the society, the policy maker, and the public have some misunderstanding, misconceptions about their need. Yeah.
I would like to go first because of sometimes not just only older people or government. So I think all of people, because in the world that we living, we not live alone. We living with a different culture. We living with different context. We living with the people, different language, different like a belief. So that means in my point of view, it's not like a one size fit all for every policy, but the policy able to make it more broadened to the ratio, the big ratio of the people. So that's why our activity or our scheme is very important. So that means don't just only blame the government that unable to do the like a not the like a fit policy, but we as the people who living in the same community, so we would like to help the government and also work together to filling the gap. So that's why for the MINT program for the Young Happy and also Body Home Care existing, because of we would like to support or help. But the way that we think sometimes because of the government or the policy maker, sometimes it's just really like a thing as the big picture, and because of when they work at the government body, it's not flexible like our work. Sometimes the social enterprise or the non-profit or the CSO is more flexible. So that's why the thing that we able to do is faster than government, but we able to do very small, just only some like a case study or some model, small model, but the government able to like apply or adopt this model or idea in a wider impact or more impact than our organization. So in our perspective, the older people not like the burden is also like a resource person like MINT project and also Young Happy also sharing that they're not just only like the people that not benefit to the economic, but they still like working in Thailand. More than 1/3 is still like continue working, and the age of 60 right now is not like in the past. The 60 right now is very strong, very fresh. Some people live age higher than 60. Some people strongest than the people not age 60 yet. Like in my community that we work with volunteer, a lot of volunteer age around like 75, but they look after the patient age 60 or 58, some kind like that. So that means it's not just only like the right perspective to look at just only age, but it just they need to looking at so in Thai word we not talk about age, but we talk about like frail or ภาษาไทยเราบอกว่า อายุกับความชรามันต่างกัน พี่จะอธิบายยังไงวะ so this is something that I unable to explain in English, but I asked to May to help.
Age and being old
Yeah,
is
yeah,
not
yeah, yeah,
fair.
yeah. Very,
Yeah,
very like that because sometimes the age just only like the number,
yeah.
right? That being old is different. Yeah. Thank you.
I heard from Tomoe last time that we talked that the age or number of age, like you count people at elderly in Japan is quite different from Thailand. So the condition of people working and still working is quite different. Could you share some like context of Japan to us?
Yeah. So yeah, like even though Japan is already super aged like society, and actually many of seniors are engaged in working. Like for example, like about 65% of men who are over 65 years old are working or volunteering, and 45% of women over 65 are also still working or volunteering. And you know, by seeing this reality, but still, as a whole society, still labels seniors as dependent, as a, you know, kind of like, oh, they are still weak. They are still, oh, they are weak and they are really like slow to remember things. They are physically weak and things like that. And actually, a lot of seniors work as a security guard, like persons or part-time assistants at welfare centers. And Japan is already facing a lot of labor shortages in service industries. And actually, a lot of seniors are covering this labor shortage, and they are the active kind of roles in the workforce already. But still, like general people, younger generations, and also the public or policymakers still see them as a dependent. And we have a very generous medical kind of insurance system for elderlies. So for those who are older than 70 years old, only pays 15% of the medical fees. And as age rise to 75 years old, so people who are over 75 years old, they only pay 10% of the medical fees. So it's almost like free to go to hospital for them. So the reality is that because society labels them as dependent, many seniors go kind of hang out at hospitals to just have a chat with nurses or doctors. So they don't. So for those who don't really work or who are not really active at working, they just go to hospitals to kind of kill times or just get a social connections. So yeah, so I think that personally think that it's a not a really effective way of spending the government resources. Definitely, there's a lot of rooms to improve the efficiency and also for the financial sustainability. So yeah, to really going back to the independent aging. So it's really important for public to respect the dignity and the personal choices of seniors. So for those who still want to contribute to societies, I think that you know, we could maybe change the systems or the incentive or you know, in order to kind of nudge seniors who still want to actively work can get a more incentives, while people who are really in need of the supports or medical cares can get a support. So yeah, so it's a really so actually it's a heating discussion point for the next generations, because I think our generation, people who are in 30s, 40s, when we get older, I don't think the government's financial situation isn't sustainable if we continue this way. So yeah, we really need to redefine this concept of who are seniors, who are dependent. Yeah.
Yeah, very agree with the point that you mentioned. So, to move beyond the traditional healthcare lens or the dependent, so how might we design a broader ecosystem of social or emotional or economic support for the elderly? Maybe Kun Gap can like explain about this in your view.
You give me a little bit difficult question.
Following from Tomoe mentioned, so I asked for your answer. Maybe
Can
you
you
can
help?
share like three of you maybe have some obedience. Yeah.
Maybe Tome, you want to mention first? I let the lady first. Better.
Yeah, traditional healthcare lens. Yeah. Yes, so we need to, definitely go beyond the idea that supporting older adults only means providing care or medical services. And like just give seniors room to choose and allow them to keep contributing if they want to. Yeah, but still, even though many older adults are healthy and motivated to work, in Japan, still ageism in the workplace remains a big challenge. And it's common for people in their 60s to be rejected at interviews simply because of age, because they want to hire younger, talented people for better position. And so I think that, like we really have this, stereotypes about older people as a, dependent of the social welfare system. And, if we, as a society, if we, continue promoting elderlies to contribute to the societies, we really need to change our all generations mindset of this, stereotypes about older people. So it's a big challenge. It's we all need to work together, all across different generations to, move this, move from here. Yeah. Sorry, like I don't really have an answer, but I think that it's a really big challenge.
I think that is a good point, Tome.
Answer.
Yeah. Okay, maybe I add on Tome a little bit. Okay, so I think maybe we don't have the like one size fit all to answer for everyone, right? When they get old, right? I think this is the thing that we should to remind to everyone that it depends on context and condition, right? That anyone should decide to retire as they want. I think this is the biggest idea that everyone should set during the time that they can have like time to prepare on it. So I think many people they think about aging, right? Is when they get old, they need to think about it. But I think right now many organizations they think about prepare well. Like in Thailand right now, if you went to Thailand right now, you will saw the campaign as like 40 up. Like 40 up something that you need to prepare yourself already. It's like 40 plus something, right? Because we know that if we promote people to prepare themselves when they're 60, maybe it's too late already. And maybe for the length or the norm of the society that we work, like we study 20 years, we work 40 years, and when we retire 20 years, maybe this concept gonna be changed in this digital era. So this is the thing that everyone should think about. Retire is doesn't depend on age anymore. So retire is depend on other conditions. So this is the thing that I would like to add on. It's not about age anymore. Yep.
Yeah. and actually refer back to Tomoe about like a limit seat in the company. I think because of in the past when we living in the industrial age, so that means we have a lot of like people to work in the factory, some kind like that. But the world changed. Right now we living in the like a digital age or AI age. So that means in the future, the manpower position will reduce. So if we just only look for the limit seat that need to like maintain or extend the retirement age only, it's not enough, because it still be like not enough for all people or like a population. But in Thailand, actually, we come up with many ideas. For example, the project called Second Life with Thai Health and also มนุษย์ต่างวัย มนุษย์ต่างวัย is the online channel that share about like after retirement you have a new life that you can like make you more like strong and also have the new life to can earn income. So this is something that develop or escalate from the hobby. So that means in one life we not just only like have the single position in the society. So that means if the government think about this, because of we will have a lot more people that unable to like work in the old structure. So that means it should be like a new structure or the new platform or area that they can have a new like occupation or contribute to the society. So this is something that right now I also am not sure that what is gonna look like. But I think if we think beyond that, in the future, just only the old way of work maybe not enough for the like older people and also like younger people. So just only would like to add on that. And I think also the perspective of prevention or like defend or respond on the problem is something that is a little bit need to change the balance, because right now I think many policy is launched or developed on responding of the problem, but not much policy that think beyond or like go beyond before the problem happen. Like Kun Gap mentioned that right now in Thailand we try to promote that age 40 plus need to like prepare. So that means when I work for the like older people issue, we talk about like 55 5 years before 60. But when I run the body home care, we talk about like 45 to work prepare before like aging society at that moment. And right now we like scale the age down to 40 to prepare. But actually for the physical, and also I think the research also show that after age 30, every system in our body will decline, right? But if you can or able to maintain it more proper, it can be extend your longevity. So this is something that very new. So that means when we develop the policy or we talk about like a aging society, not just only focus at the
I
older
agree with
people, we
that.
need to like think beyond.
Okay, so actually we have only 5 minutes left for the session because our time is quite limited. So I have Sophia from Kenya who chat in our chat box that she also working on this issue. So I would like Sophia to share a little bit about her work for all of us, maybe just 2 minutes, and then just briefly introduce yourself. We would love to learn from you as well, and then we will have the last question for closing the session. Hi, Sophia. You need to turn on the mic.
Oh, yeah.
Yeah,
Thank
nice to
you.
meet you.
Nice to meet you. Thank you for giving me this opportunity to speak. I'm so happy to see young faces speaking about aging. It's a really good thing. I run a community-based organization called Golden Age Africa that focuses on taking care of the elderly people in my community. I came to realize that elderly people in Africa, many of them actually live below the poverty line. In Kenya, we have a program where the government usually sends about 2,000 shillings to the elderly people. Actually, 2,000 shillings may sound like much, but if you calculate 2,000 shillings, that's just about $15.
Wow.
Yeah. And most of them are actually living with the burden of health challenges. And some of them are even taking care of their grandchildren. So the 2,000 shillings is not enough. And that is why we are encouraging more young people to come on board and form organizations to support the elderly. Unfortunately, many programs or a lot of funding goes towards taking care of women, orphans, and young people. And there's very little focus on the elderly. So it's a very new field here, and many people don't understand. And actually, unemployment rate is very high in our country. So it's not easy to tell the elderly people to save. Some of them are actually living comfortably, but I can say maybe 8 in every 10 elderly people I have met, actually, they live in poverty. They struggle with housing, very poor housing. They don't own land. And those who actually own their properties are in land disputes with people who either have tried to grab their land or have already grabbed their land. I also focus a lot on age-appropriate nutrition because, as you know, nutrition is very important for us to be able to manage or prevent healthcare issues. So that's what I mostly try and focus on. I focus on getting a lot of age-appropriate foodstuffs to the elderly. And that means we focus on a lot of indigenous foods. So, and as you know, organic and indigenous foodstuffs, they are not exactly cheap. So I rely on well-wishers and donors. And my organization is still growing. We are actually 2 years old. And we are looking to take on board more elderly people. Right now, I directly support 5 elderly people in my community. But there's a lot of need because I know 30 or more elderly people who need our support as an organization. So I'm very happy to get this opportunity to speak. Kindly connect with me on LinkedIn. My name is Sophia Katampo. You can check on the comment section. And I'd really like to see I came in a bit late because I saw the email notification late. But I'm happy I caught you guys, and I'd really like to see if the Buddy Home Care can send me the presentation. I'd really be happy to see what you guys are doing in Thailand and Japan. And hopefully one day you guys can visit Africa and see the work we are doing, because in Africa we have a young population. We have a very big young population, but the elderly population is quickly growing, and we as the continent, we are really not prepared for what is ahead. I feel Japan is really prepared for what they're dealing with right now with the aging population, but Kenya is yet to learn from countries like Japan and Thailand. Thank you so much.
Thank you, Sophie. Yeah, actually we have 1 minute left. Shiher, can we have like 3 more minutes late from the session?
Yes,
Or-
absolutely.
Okay, so I just want to ask the closing question for all the panelists, and hope we can still stay connected after the session. Yeah, especially with Sophia. So the closing question for me is like if you could send one message, just only one brief message to the public watching this panel, what mindset shift would you like to inspire other aging and independence?
My message would be that we need to take care of ourselves, but we also need to take care of each other. We need caring cities. Thank you so much.
Thank you. Yeah, and you are the panelists.
So for for me, because of I work in the like a OA issue for a long time and have a network of help aid all like over the world. So that means Africa is also like one of like our member in like in Europe and Africa. I think they have a lot of like organization work with the group, and we happy to share information to you, nah. So for the one motto that we always
One message, yeah.
it's like over is not over, older is not over. So that means when you get old, it's not like at the end of your life. So you can start a new journey.
Thank you.
That's so cool, Pichen.
Hey,
Okay,
yeah.
so for Young Happy, maybe I try to like think about it also, but maybe just one thing that in our mission that we try to support senior, that we wish everyone found their new North Star. I think this is the one thing that we try to push them, right? Everyone, if they know what is their North Star, right? I think that will make them happy to wake up in every day. So this is the thing that we love to encourage everyone to find their North Star. Yep.
Yeah, so oh yeah, I'll go. Yeah, so I would say aging is not something to be afraid of, but something to be designed together. And yeah, if we can see aging as a continuation of growth, not the end of it. And I think when we think about aging, like we automatically think about like a very fundamental humanity questions, like what is the reason of working for us, or what does happiness mean to individuals? And when we think about aging, we can question our big questions as a human. So I want to keep pursuing this field, and because I feel like I can understand more about human.
Very impressive. So I think what I have learned and what we have seen today is aging is not about adding years to your life. It's about adding life to years. So if we can build social system that support independence, connection, and dignity, we can turn this demographic shift into an opportunity for everyone, every generation, not only aged people or the adults that we mean, but it's all about people in the same community, in the society. So I would like to thank you for everyone for sharing your insights and your energy on your work, on your value of your life. So let's continue to work together to create societies where people can age well, not just longer, but better together. Thank you, everyone.
Thank you.
Thank you, everyone.
Thank you ขอบคุณครับ
Thank you.
Thank you so much. Bye.
Bye.